aspects of the system that we've developed in partnership with Paqua really entails three main concepts. The first one, of course, is excellent engineering and integration of products. The second thing is the integration and implementation of appropriate membrane technology. And the third thing is the introduction of a new kind of disinfectant, which is chlorine based, but operates very, very differently to conventional chlorination products. Most chlorination is achieved through the use of hypochlorite. In most people's dictionary could be termed as bleach, so household bleach. So hypochlorite is used extensively. Sometimes chlorine dioxide is used, but whichever type of chlorine disinfectant is used, these things are known and are well understood to be corrosive to membrane materials. Our system incorporates something called hypochlorous acid. This is being widely used in the clinical space, so whether it's dentistry, primary care, whether it's for wound healing. Hypochlorous acid is a well understood clinical therapeutic, so they're using it quite widely in the healthcare space. We've been able to take that concept, integrate that with our membrane technology, so that we have a system that produces this hypochlorous acid on demand using only salt and water, which can produce this disinfectant. And this disinfectant can be used to maintain membrane health, to stop it getting blocked up and stop this biofilm formation, and secondly, to disinfect the water. And through the research that we've conducted, we know very well that the use of hypochlorous acid is not only safe, but actually is more effective. So we know that at the point of use, hypochlorous acid is delivering healthy membranes, it's delivering disinfection, and it's also delivering lower disinfection byproducts. So at the point of use, when you need it, bringing all these technologies together enables the production of clean water. Although we spent a lot of time with our partners developing water treatment systems that utilise membrane technology, utilise hypochlorous acid, we're also doing quite a lot of work on understanding what we can use hypochlorous acid for in other sectors. So this includes working with clinical partners up in Edinburgh, certainly clinicians such as plastic surgeons, which require novel therapeutics or novel antimicrobials for treating wounds and sterilising equipment. We did a recent project in partnership with the MOD and with partnership with other colleagues here at UWE, which sought to develop technology to produce hypochlorous acid within a very mobile device, such that it could be used for remote medical situations, i.e. that you can produce therapeutic solutions, antimicrobial solutions, maybe even produce sterilised or sterile water for medical applications in a sort of a setting where access to resources are very, very limited. So that may be emergency healthcare, which could be provided, say, in a disaster zone. We're also investigating the use of hypochlorous acid as a suppressant for airborne viruses. So obviously, throughout the pandemic, one of the key take-home messages was that we did not have enough suitable technologies that could control air quality within indoor spaces, and this was particularly important in places where people were required to work. So think about hospitals, think about primary healthcare settings, think about dental surgeries. There was a time where dentists could only see 2 or 3 people a day, because in between patients there had to be 1 hour or maybe 2 hours of fallow time. That is where people had to leave the room and the room had to be evacuated of air because of the fear of transmitting disease through contaminated air. What we're looking at is saying, can we aerosolise hypochlorous acid and can we investigate the interactions of that aerosolised biocide with aerosolised viral particles? And certainly our initial results as we would expect, that we are seeing a massive suppression of viral loads when we supply aerosolized hypochlorous acid into a contaminated air environment. Now that has implications moving forward that will enable us to control air quality in terms of contaminated air, and actually to suppress viral loads, reducing infection, or causes of infection with airborne diseases. And of course that was very obvious with COVID, but it could just be obvious with other infectious diseases. This also has implications not just for human health, but it has implications for veterinary and animal health. So one of the key aspects at the moment is swine flu, for example, which is really affecting farming, for example, and a lot of agriculture. So we're really pushing research along those various fronts. So one of the key benefits, and this is something that I feel really strongly about, I'm really passionate about, is reducing the carbon footprint, or to making the products that we use much more sustainable. So let's really unpack a lot of this for a start. So if you think of a hospital, if you think of a university, I mean we're in the university grounds now, and you think about how much cleaning products or how much bleach is used in those organisations. Each time you use bleach, there is energy, there is chlorine, there is the possibility of contaminating or certainly polluting the environment. So say if you take a large organisation, it is not unrealistic to say that those organisations are spending tens of thousands of pounds, maybe even hundreds of thousands of pounds on disinfectant. Each of that products needs to be produced somewhere. Each one of those products needs to be put in a lorry or put in a boat or put on a train or whatever, and needs to be transported to supermarkets, which then in turn are bought by consumers. So the whole carbon footprint of these products is incredibly high. Now moving forward, we know this is unsustainable. Even if we just talk about plastic packaging alone, this is unsustainable. If we talk about the use of energy and the use of chlorinated products in the environment, we know all of this is just not sustainable moving forward. Imagine a system where when you need a bleach, you could get bleach, or if you needed a disinfectant, you can get disinfectant at the push of a button. That then negates the need for tons and tons of plastics. It negates the need for tons and tons of fuel that are used to transport these things. So in that respect, being able to produce a safe, effective, biocompatible disinfectant using very modest resources and power is a game changer.